everyone, and welcome to today's session entitled New Models for Senior Transportation, the Rise of the Sharing Economy. I would like to introduce Cindy Padilla, Program Lead for the Rural Aging Initiative for Grantmakers in Aging and moderator for today's webinar. Cindy, welcome.
Thank you so much, Sarah. And on behalf of John Feather, who unfortunately could not be with us today, welcome everyone, and thank you all for joining us today. Before we begin, we would like to thank the John A. Hartford Foundation, whose continuing support allows us to provide this webinar free of charge to our audience. We also want to thank today's co-sponsor, the Consumer Technology Association Foundation. To accelerate and expand an emerging drive to improve the experience of aging, Grantmakers in Aging is leading an initiative designed to connect and support key players concerned with rural aging, to share knowledge and help expand resources and services available to older adults in rural areas. This initiative is supported by a grant from Margaret A. Cargill Philanthropies. Aging in rural America often reveals a quiet and resilient strength for people living in our rural communities. Aging in rural America also reveals many overlooked and difficult challenges. While older people across this aging nation face similar challenges, the physical and social isolation that can occur in a rural setting compounds problems and makes it even more difficult to age in place safely and well. Access to transportation is a huge determining factor in aging well in a rural place. An older adult who cannot drive is immediately at risk. The Housing Assistance Council has found that 13% of rural seniors have no vehicle, and approximately 40% of all rural residents live in counties with no public transportation services. One response with a good track record in rural communities is ride-sharing programs, often formed through partnerships with community organizations and that partly with volunteers. To talk about this subject today, we have Dan Treiber, Head of Elder Mobility at Lyft, and Stephen Ewell, Executive Director of Consumer Technology Association Foundation. Welcome to you both. And
thank you for having us.
Great. Before we begin, I'd like to point out that, as usual, we will take questions at the end of the presentation. And you can enter your questions at any time using the question box on the right of your screen. So Dan, let's start with you. Can you give us an overview of Lyft, your mission, and share with us some examples of successful and hopeful transportation models using a shared economy? What that means and how these models are changing how people are looking to modes of transportation. Dan?
Absolutely. And yes, and thank you so much for having me. I just want to say thank you to Grantmakers in Aging, the foundation, the sponsors for giving us this great opportunity. So as mentioned, I help lead our elder mobility focus within Lyft. My background before joining the company, I'm actually going to hit my 1-year anniversary next week. But my background has been in healthcare. My family actually operates one of the largest home care businesses in the Bay Area. So we've been in the business for almost 15 years now, and I've spent a lot of time in the industry, meeting with home care providers, working with elder care providers, and spending a lot of time within hospitals and health systems. And the reason I mention that is I've always seen in my personal experiences, and also being a caregiver for my grandparents, how transportation is such a barrier to effective healthcare delivery, both in major markets and rural areas across this country. The one statistic that my team and I share when we meet with people all across the country is that every single year, 3.6 million medical appointments are missed or delayed because people can't get there in the first place. So for us at Lyft and our company, our mission is to reduce this number to 0 one day. And without question, with technology, with the platforms we have in place, we can achieve that goal. So with that said, let's go to the next slide. And as we dive a little bit deeper here, I want to make sure that everybody understands who Lyft is and who we are as a company, because our DNA, what we're made from, what drives us every day within this organization is very important for healthcare, and why I think you'll find that we have a dedicated approach within this space. So next slide, please. So for everyone just to understand, our mission at Lyft, what drives us and all our employees is to improve people's lives with the world's best transportation. Yes, there's other companies out there that get people from point A to point B, but the way we go about it, the way we treat our drivers, the way we treat our passengers is very, very different. Most people don't know this, but the original pink mustache, the original branding of the company, really came about because we wanted a rideshare network where a female would feel safe getting into a car with a stranger. And certainly it's more than a pink mustache that's going to achieve that goal. So everything that we do around safety, security, background screening of our drivers, which we'll get into some detail here, it really speaks well towards the use case of healthcare, and again, why we're so passionate about it. Next slide, please. So my team, what we focus on is building business relationships, working with hospitals, working with health systems, working with elder care providers to really serve those that they work with every single day better when it comes to transportation. Whether it's our elderly, our low income, our at-risk population, we know how critical transportation is. So for us, when we work with organizations, and we'll go through some examples, companies like Brookdale Senior Living or Comfort Keepers or mom and pop home care providers, we want to help them reimagine how they provide safe, affordable, and friendly rides to the people that they serve each and every day. Next slide, please. So really quick about ride sharing and just the idea of ride sharing and the concept. It's come a long, long way in the last couple of years. Lyft has been around since about 2012. And we've really evolved quite a bit from that pink fuzzy mustache. You know, our goal, when you think about it, your vehicle, for all those on the call today, I'm sure many of you own a car. 96% of the time, it sits in your driveway. 96% of the time, it's not even being utilized. And oh, by the way, when you are in your car, it's usually at a 20% occupancy. You have you're in the car by yourself and you have 4 empty seats next to you. So really it's about reimagining transportation for us. You know, I have a 3-year-old son. I truly believe my son will not know what it is to have a driver's license, given all the things that ride sharing can provide. So this slide here just gives you an illustration. You know, ride sharing has really outpaced other forms of transportation. Just not too long ago, there was an article in the Wall Street Journal. In New York City, ride sharing outnumbers taxis 4 to 1. And it's pretty amazing to just think about that in just a short period of time, how ride sharing has really been adopted, not only in this country, but across the world. Next slide, please. So here we just want to visualize a little bit about transportation as a service, which is what Lyft is all about. When we look at ground transportation, or transportation in general, it is over a $2 trillion industry. And you know, when you think about it, we're just at the early stages of ride sharing. When you think about where we are today, we're just at a small fraction of the potential opportunity within ground transportation. Next slide, please. And you'll see as we evolve the next decade or so, we believe ride sharing will become more and more of the norm. And with that, we think it will be an amazing benefit when it comes to transportation for healthcare and transportation to our elderly, at-risk, and low-income population. Next slide, please. So here, just a little bit of an update of where Lyft is today, where we've evolved since 2012. So we are right now in over 300 markets across the United States. And in the last month or so, we launched about 100 new markets, which you'll see here in the visualization on the slide here, showing you some of the new markets that we're in. Now, certainly today we are very focused, we are very penetrated within all the top markets across the country. So when you look at major cities, top MSAs, we are certainly in all those markets. However, we are now growing to a lot more rural markets, a lot more smaller cities across this country, and not just in densely populated areas. You know, our mission is certainly to be everywhere eventually, and we are well on our way to making that happen. Today we have close to 1 million drivers on the road, and we are doing, this number is a little bit dated now actually, the numbers changed quite a bit, but we are doing over 20 million rides a month at Lyft. And then I mentioned earlier about our original mission, our foundation as a company was really around safety for females and making a rideshare network where a female would feel safe. And our passengers today, about 60% are female, and about 30% of our drivers are female as well. Next slide, please. So here is some of that detail. I mentioned earlier that certainly it's more than a pink mustache when it comes to safety, security, reliability, and the way we go about those things when it comes to driver and vehicle inspections and checks. So all our drivers go through a criminal background check. We at Lyft use something called Sterling, which is our background screening service. It's FBI accredited. Fortune 500 companies use Sterling, and it's a great service, a third-party service that we use for all our drivers. The other thing we do is 19-point vehicle inspections. We do annual driver record checks and screening. And something that's also very unique to Lyft that our competitors do not do is that we meet all our drivers. So if you want to drive for Lyft, you can't just become a driver over email. You have to meet with a representative. We do a mentorship program, and we get to know our drivers before they go on the road. In terms of legal and regulatory work, we work closely with governments across the United States. We have legislation passed in pretty much in the vast majority of the states in this country, over 36 states plus the District of Columbia, and we work with local city and state regulators to make sure that we meet their guidelines around ride sharing. We also have a 24-hour critical response line. So this is really important and very unique to Lyft as well. We have over 450 people in Nashville that can be reached 24/7 any time of the day, and the driver, a passenger, can reach a real person. We also provide excess coverage, and we have $1 million in auto liability insurance and a policy that goes in effect in addition to whatever the drivers have. So from a safety, compliance, risk standpoint, we make sure that our partners get what they need in terms of the risk component of putting a patient or an elderly person into our car. And the other thing, too, is in terms of just the platform. Doing 20 million rides a month, we have tremendous data about our drivers, tremendous data about our passengers, and that really goes to our 5-star rating system. So we have continuous feedback about drivers, things that we do, for example, if you have a bad experience with your driver and you give them a 3-star rating or below, you will never be matched with that driver again. So the feedback's really important. We have a zero tolerance policy. So if you took a ride with Lyft and for in your review you put keywords like alcohol, swerving, anything like this, we immediately deactivate the driver and we investigate. If a 5-star rating of a driver falls below a 4.6, we also immediately investigate and take a look at what's going on. So a lot of these measures and procedures we have in place really help ensure the quality and safety of our network. Next slide, please. So the other thing I just don't want to overlook, too, is really the cost savings that we provide our partners. On average, Lyft is 35 to 55% more affordable than other ground transportation solutions, including taxis. So the cost savings that we provide through our platform is significant, and that's really where our partners also see a lot of value in working with Lyft. Next slide, please. So the other thing I just want to mention real quick before we dive into what we're doing in healthcare is we've matured as a company. We've moved away from the pink mustache, and we recently launched this new feature called the Lyft AMP. So if anyone's ever gotten into a taxi, an old school taxi, and you're familiar with that sign on the roof of a taxi that tells you if they're available or not, this is our version of that sits on the dashboard of the Lyft. When you request a Lyft, the application will also tell you what color to look for your vehicle. And we can control the color of this AMP, and it will tell you, look for the green Lyft or the blue Lyft or whatever it might be. Next slide. And then what's also really cool is on the back of it, we can do custom messaging to the passenger. It can say, hello, Dan, welcome to your Lyft today. Or we have partnership with Brookdale Senior Living, Brookdale can say, Brookdale welcomes you to your ride today. So imagine kind of the experience we're creating in our car. It's no different from when you walk into a hotel lobby and that concierge is trying to earn your tip. The bellman is trying to earn your tip and greet you and make sure you have a welcoming and warm and friendly experience when you get into that hotel. That's a very similar environment and experience we want all our passengers to have when they get into a lift. Next slide, please. So I'd like to dive a little bit deeper into what we're doing in healthcare, which I know most of you are probably really excited to learn about. So next slide, please. The short answer is that we're doing a lot. In the last year or so, we've really made a lot of key partnerships and developments in this space. To kind of set the stage, transportation is so critical to our 65 and older population. All the data shows that those without access to transportation of our elderly population take fewer trips to see friends and family. They take fewer trips to go out and eat or go to get groceries. And they take fewer trips to go see a doctor or go to a medical appointment. And that's how and why we believe our platform is so critical to our elder population. Next slide, please. So this is just an example, a flavor of the work we're doing within healthcare. I just want to make sure everyone kind of sees some of the partners that we have. These are some of the areas and verticals that we work in. So really quick, we do a lot of work in senior living. So we have tools. Many of you might be thinking, okay, listen, this is great, and Lyft has a focus in healthcare. The elders I serve or the elders in my community don't have a smartphone or don't even know who Lyft is. What good is Lyft to my population? Well, we've built a solution, which I'll show you shortly, where our partner, let's say Brookdale, and we work with many senior living operators like Life Care Services, Milestone Retirement, Sunshine Retirement, and the list goes on and on. We allow them to schedule on demand or up to 1 week in advance rides for their residents. So the resident will go to the front desk, they'll call the front desk at the community, say, I want to go somewhere, and they coordinate the ride upon their behalf. We do a lot of work with home care providers. So we have a great partnership with Comfort Keepers and many other home care providers like Home Instead and others, where they're now using Lyft to get their clients to and from appointments where they don't have to worry about the caregiver driving a car, and then also to help their caregivers to get to and from their appointments by themselves. The caregivers can now be more productive. The caregiver can take their notes, get ready for their next appointment, and if they're in a car with the client, they can attend to the client. They can sit in the back seat with the client and be focused on them, not driving a vehicle and trying to find parking for their next appointment. We do a lot of work with hospitals and health systems. So we have a great partnership with Ascension, which is the largest not-for-profit health system in this country, and they use us for patient discharge and patient flow. A case manager, a discharge planner will have access to our tool, and they will schedule rides on behalf of the patients when it's time to leave. We also work with a lot of technology companies like Great Call. Great Call has a product that some of you may have heard of called the Jitterbug phone. It's basically a phone designed for our elderly population. Very easy to use, big numbers, very simple. If you have a Jitterbug phone and you dial 0, you can now request a Lyft ride. So their call center, their operator, has access to our tool, and anywhere in the country, they could coordinate rides for those that have a Jitterbug phone. We're also doing a lot of work in what's called non-emergency medical transportation, and this is primarily for our Medicaid, Medicare Advantage population. The U.S. government, every single year, spends $6 billion on non-emergency medical transportation for Medicaid beneficiaries. How it works is that there's these brokers, these middlemen, that coordinate the rides for this use case. Logisticare is one of them. Logisticare did 70 million rides last year for non-emergency medical transport. The vast majority of those rides are ambulatory, curb-to-curb transportation, and instead of using taxis, they are now using Lyft. And then finally, we're doing a lot of work in clinical trials. So a clinical trial is only as good as that patient showing up to take their medication and showing up to take the drugs of the pharma company. Patient retention, recruitment are big issues for pharma companies, and they are now using Lyft to get the patients to and from a trial. So these are some of the partnerships we have in areas of focus for our healthcare team. And you know, one other story I'd love to share is how we're in senior living. We meet with residents all the time. And recently we had a resident tell me that I did not want to go to a movie theater and show up in a public location in a big shuttle and bus that said Brookdale Senior Living on it. I just wanted to be like everybody else and go out into the community and not let people know that I live in a Brookdale. Well, now they can. Now they can request a lift, a friendly, safe, clean car, and get to those places that they always love to go, just like everybody else. Next slide, please. So I really just want to quickly cover the tool that we have that we call Concierge. Next slide. And we're going to quickly go through these slides. But basically, this is a web-based platform that our partner, whether it's a nonprofit organization that's serving the elderly in their community, to a hospital, to a senior care community, this is the tool that they have access to. Next slide, please. So how it works is it's a web dashboard. They go in and enter the name of the passenger or the resident or the patient. They enter a contact number for them, a pickup and drop-off location, and then they also enter if they want to leave right now, or they can schedule up to 1 week in advance. So a couple things just to point out. We treat personal health information very seriously at Lyft. We never share the full name of the passenger with the driver. They just see first name, last initial. And we never share anyone's real phone number with the driver. We just, what happens is we take the phone number provided, we generate a random number that is shared with the driver, and then if they call it, it routes to the real number. They don't know the difference. But from a privacy, safety standpoint, we're never sharing anyone's real phone number. And then finally, there's a notes field that's optional that our partner can enter. So in this example, you see a billing code XYZ. So we provide detailed reporting to anyone who uses our dashboard, and in that report would be this notes field that helps them reconcile this trip. Because how our business relationship works is we send a bill, a monthly invoice to our partner for all the rides, and then they pass the cost to their residents, or in some examples, they get reimbursed by Medicaid for the ride, and they may enter a Medicaid ID number. As you'll see on the right-hand side, we give a fare estimate before the ride is scheduled, so the senior community can tell the resident this is going to be about a $40 ride, and there's visibility into pricing. Next slide, please. Once that information is entered, it takes about 5 seconds to do that. It's submitted into the system. Next slide, please. And then we are matched with a driver that can meet the needs of this trip. So you'll see David is our driver for the resident. We have this ETA. We literally see David on the map. You see the car there, and you will always know where David is from point A to point B, and even when he's on his way to pick up your resident or the elder that you're serving in your community. You also have information about David's phone number, vehicle information, license plate number. Next slide, please. And if the passenger has a cell phone, you entered their cell phone number, they will get a text message to let them know their vehicle is on its way, be on the lookout, and information about their driver so they know what type of car to be looking for. Now, if the passenger doesn't have a smartphone or cell phone or doesn't, you don't know their phone number, that's fine. You can enter the number of the person coordinating this trip. So this could be the case manager's phone number or the person at reception in the community, or whoever's organizing the trip. They can be the touch point during this trip. Next slide, please. And as I mentioned, this is just a sample, a flavor of the reporting that we provide. So there's literally a line item for every single trip, pickup, drop-off location, mileage, cost, duration. It's actually a lot more information that's what's on the slide, and it can be downloaded into a file. So, you know, when we work with our partners, they're used to dealing with paper pen taxi receipts and really just a fuzzy accounting system and fuzzy numbers that they never had really true insight into. And that's one of the things that our partners really benefit from this platform, is having that level of accountability and visibility into every single trip. Next slide, please. So what I'd like to do is quickly touch on a case study. So I mentioned we work with many elder care providers, many hospitals. Next slide, please. This is an example of Brookdale. And so many of you may be familiar with Brookdale. Brookdale is one of the largest senior living operators, the largest in the United States. They have over 1,100 communities. They serve over 100,000 seniors across the United States. We've been working with them for a long time now. We're in about 30 to 50 locations today and growing. And it's exactly that system I mentioned earlier. The resident will call the front desk or go to the front desk and request a lift. What I'd like to now do is show a video of how this works. And it might be a little bit choppy because of the screen share, but you'll at least be able to hear it, which is what's most important. So next slide, and I'll stop talking and allow everybody to see how it's working today. Thank you.
I used to love to drive a car, but with my age, I realized that my reaction time was not as good as it should be, and I was becoming a road hazard. I'd like to request a lift ride, please, to the florist. That soon. That's great. I'm very happy that we have Lyft because it will give me freedom that I haven't had. From my apartment, I can call the front desk and they will call Lyft, and I will be downstairs, and within a few minutes Lyft will be there, take me to where I want to go. It's very, very convenient. Okay, let's go. I love community living. I do a lot of things in Brookdale. I am a painter, so I paint. Also, I sew. And on Friday afternoons, I plan to go to San Francisco to the Museum of Fine Arts up there, and also the newly renovated and newly opened Museum of Modern Art down on 3rd Street. It's gorgeous. You're welcome. It was nice hearing you. Thank you. So you have a lot of plans with Lyft. I do. Yes. It's almost like having a car, only you don't have to buy the gas or park.
So next slide, please. So as we just wrap up here, I just want to share with everybody, stories like this, stories like Pat, and there's many others out there like Pat. And I've been very fortunate enough to spend time with Pat and learn how this has really impacted her. And it's really our belief and our goal that with a platform like Lyft, with ride sharing where it is today, without question, we can increase the independence of our elder population. We can reduce isolation and allow our elders to get back out into the community, whether in major cities or in rural markets across this country. Transportation should not be a barrier, and we know how critical it is to their day-to-day life, for their caregivers, for their family members as well. So for us, this is really what our mission is about. You can see here some contact information, and you can always learn more on our healthcare site. And then just a note, Brookdale on their blog, if you go to the Brookdale blog, they told this story about Pat and others last week. So it's a great resource for everybody. But I appreciate everyone's time. That's all I'd like to cover, and look forward to questions later on. So thank you.
Great. Thank you so much, Dan. And next we will hear from Steve Ewell from the Consumer Technology Association Foundation. But before we go on, I would just like to remind you that you may enter your question for our panel at any time in the question box on the right side of your screen. I will read the question to the panelists at the end of the presentation. Okay, Steve, can you please share with us a general overview of some of the newer innovations in technology assistance options in transportation, and describe new models for senior transportation?
Sure, thank you, and thank you, Cindy, and really pleased to be able to join this group here. Grantmakers in Aging, I think, is a really important organization. We've been very pleased to be a member of it, and really I'm excited to build off what Dan was able to share as far as what Lyft is doing in the ride-sharing world, with an example or a few examples of some of the technologies that are either currently available in here, or some of the technologies we're going to see coming down the pike that will really help us to all be able to drive safer and remain independent for as long as possible. So if we could go to the next slide, please. Just wanted to give a very brief introduction to who we are. The Consumer Technology Association Foundation is a public charity, a charitable foundation affiliated with a trade association. The trade association represents over 2,200 technology companies, including Lyft, but actually 80% of the businesses are small businesses or startup companies, and probably best known for running CES, which is a big trade show that occurs every January in Las Vegas. We like to say it's where the world's gathering place for all who thrive on the business of consumer technology. And when we're there, and we actually just celebrated our 50th year this year of CES, we have opportunities to look at all kinds of technologies, from smart homes to 5G wireless to wearables, health and fitness, and of course vehicles is a major aspect of what we see at the show. Next slide, please. We started the foundation just about 5 years ago and really wanted to look at how we could give back to our community. And so when we created the foundation, we looked around at what people in our industry were doing and supporting and realized that it's almost exclusively kids in STEM education, which are critical issues for us. We think it's incredibly important that people continue to do that. But we've wanted to go a different direction. So we focus specifically in on how technology can help older adults and people with disabilities. So we've been working on that for the last few years. Next slide, please. And in addition to some of the grants and other programs that we do, we have engaged in a number of research projects. But really, next slide, please, wanted to dig into what we're able to see in automotive. Automotive is an area that has been growing significantly at CES the last few years. It's something that we now see many of the major manufacturers splitting their time, flying back and forth in January between our show and the automotive show in Detroit. But last year we had 9 of the top auto manufacturers and over 140 auto tech companies able to show off a wide variety, from everything like some of these concept cars that we have on the screen here to some of the technologies that go into it. Next slide, please. The sharing economy is a really important issue for us as far as looking at the opportunities in this space. I think Dan really covered it quite well, particularly with the movie that he shared highlighting Pat. But we see this as an area that can grant that level of independence for people who may not be able to drive. And we hear that quite a bit from the communities that we work with. And it's also interesting when you go even beyond transportation. We had a conference yesterday where we had a representative from Airbnb talking about the largest segment of, or largest growing segment of hosts for Airbnb is actually senior women. It is an opportunity for not just granting independence for the people who participate in sharing economy, both as the host or the drivers in the case of Lyft and the other ride-sharing groups, but also as the riders taking part, so both drivers and riders. And I just wanted to show one slide on the next slide from some research that CTA did, and particularly calling out that there really hasn't been a significant variation on the satisfaction with ride sharing across the aging demographics. So the millennials are saying 86% of them are satisfied with ride sharing, and boomers are at 85% as well. So we really do see a very high satisfaction across the age spectrum for ride sharing. Next slide, please. But really what I wanted to do is to go from this conversation about ride sharing into what are some of the technologies that are in the vehicles of today that can help us all drive safer, and then look at some of the technology that's coming down the pike. One in particular, I'm actually going to talk two categories. One is driver assist technologies, and the other is self-driving technologies. Next slide, please. So when we talk about driver assist, there's actually a number of technologies that are in this space. Many of them are technologies that you can get on vehicles today. It's the vehicle that will self-parallel park or automatic parking assists. It will help brake itself if it sees a potential accident up ahead, or warn you if you're starting to leave your lane. And this is something that we're actually seeing quite a bit of interest in and satisfaction amongst users of these technologies. And really, I look at this as something that can help, quite frankly, us all as we're driving and in different communities to be able to remain safe, but also as we're aging, or if we have disabilities, this is something that can certainly help with the safety aspects on the road. Next slide, please. So next I want to go into self-driving, and this is always an area that people take quite a bit of interest in. There's actually, it's been broken down into really 5 major categories as far as what makes up self-driving. Everything from the complete human operation to complete vehicle operation. And this is something that there's many vehicle companies that are working in this space at the various different levels of this. And then obviously the National Highway Traffic Safety Administration, NHTSA, is paying a lot of close attention to these types of different technologies. But really where I get excited about the opportunity for self-driving is when we're talking about the independence of older adults, as well as people such as those in the blind and low vision community who might not be able to operate a vehicle. This is an opportunity to build off what comes now with the ride-sharing technology to lead to even greater independence for people across the board. Next slide, please. One of the things that when we look at these technologies, the nice thing about a self-driving vehicle is it doesn't get drowsy, it doesn't drink, it doesn't text, it's not paying attention to what's going on in the back seat. So we're really looking at this as an opportunity to create safety. And I thought it was interesting that based on some of CTA's research, it actually specifically called out and this was just surveying a general population, but the independence, particularly they were looking at people with disabilities, but really we see it for the aging market as well, the opportunity to create that independence. And there was a study done by McKinsey and Company that actually estimates that with widespread adoption, we could reduce accidents by 90%. And when we're talking about over 30,000 people being killed in accidents in the U.S. alone every year, there are stadiums worth of people who could still be alive thanks to this type of technology as it gets wider adoption. Next slide, please. I also wanted to call some attention to a study that was recently done, and it was focused in on the disability community, not the aging community, but I thought it had some interesting statistics come out of it. It was done by the Ruderman Family Foundation, and they looked at it and looked at both the economic opportunity from creating new employment opportunities for people with disabilities, but also from the money saved from people missing medical appointments. And that was something I know Dan raised in his part of the presentation. But Henry Claypool, who wrote this report, found that there could be $19 billion annually saved from just eliminating those missed medical appointments. So there's a major opportunity here, and I'd be really interested. I know they've started to look into a little bit about what the broader aging demographic would mean as far as the economic impact, but I really see potential real benefit for the economy as well as for the end users. Next slide, please. So next I want to kind of go into a project that our foundation is doing, and this is something that we're really excited about. It was something we announced at CES 2017 this year, And quite frankly, what we're looking for is the input of all of you that are on this webinar, as well as others around, around the country and around the world, about how would we make the most accessible vehicle possible for people of all ages and abilities. So with that, I'd like to welcome you aboard Ollie. Next slide, please. So this is Ollie. This is a partnership that we have with a company called Local Motors. They are a small automotive manufacturer. They actually 3D print their vehicles, which is really interesting, as well as a partnership with IBM, where they're bringing their Watson technology to this vehicle. What I'd like to kind of highlight is what this vehicle isn't. It's not a long-distance transportation vehicle. This isn't something you would necessarily see on a highway. It's more meant for campuses or maybe a downtown area, kind of short range, getting people around. It's also not paratransit. We're not building this as an accessible vehicle just to cater to older adults or people with disabilities. This is something that we're really hoping can be designed in a way that can help as many people as possible for the general population, but also meet all the needs of older adults and people with disabilities. Really it's an interesting partnership in the fact that, Local Motors has the expertise in how to produce vehicles. They actually crowdsource all of the work that they're doing. So this actually came from an earlier competition where a number of people around the world submitted design ideas, and this actually came from a student who I believe is originally from Colombia and was studying over in Europe and submitted a design for this vehicle. And then, by being able to partner with a company like IBM, which has their Watson technology, which doesn't just answer Jeopardy questions, it actually is an opportunity to engage. So as people can work with the vehicle and be able to really customize it to what they like. If they want to go out for dinner, they can actually access things like Yelp reviews or others where it can help to direct them to where they might be interested in going. We're also working with a number of other technology companies that will have potential technology incorporated into the vehicle, and that's really where we've been going around and meeting with a wide variety of key stakeholders to get the input and what they would really like to see. Next slide, please. So we've been doing focus group meetings. We've been collecting input online. So we've met with groups like AARP and Front Porch and the Hearing Loss Association of America, American Association of People with Disabilities, and other organizations along those lines, really trying to get the input of what would the ideal solution be for you if you had to work with this, whether you were had some mobility disabilities or blind, low vision, hearing loss, deafness. How would you like to interact with these vehicles? And it's really beyond just the very basics of ADA requirements of how to get a wheelchair on the bus, but really kind of what would your ideal solution be? Next slide, please. So that's something that I would love to hear from the group online today, or if you have ideas later, what would you like to see in a vehicle? Because we're collecting all those ideas, and this is something that we're obviously working with this partnership to be able to create a vehicle that could work well for people of all ages and abilities, but also representing a broader industry perspective. I want to be able to share this with all the companies working on accessible vehicles to make as vehicles that work for people of all ages and abilities kind of across the spectrum. Next slide, please. One other piece of technology I just wanted to highlight, and that is augmented reality. Many of you probably have heard about virtual reality, which is getting quite a bit of attention. But augmented I see as having a real opportunity in transportation solutions, because you're going to be able to overlay information on top of what you're seeing in the real world. So now when you're looking for directions, you might be able to get that arrow of where you're going drawn out in front of you, or if you're looking for a specific building, you'll be able to pull up that information and get that information provided right to you. So I'm really excited about the opportunities that augmented reality will add into the overall transportation solution as well. Next slide, please. So I really look at these technologies as being a couple of solutions that can help us all remain mobile longer and safer. But I will say they don't solve all the issues that we're looking at. It's certainly one of the issues, and quite frankly, one of the things that ride sharing is able to do better than a self-driving vehicle could do at this point is addressing how do you get into and out of a vehicle. Having that person there to be able to help and service people in the vehicles is a very important piece that needs to be addressed. We're also looking at how that actually applies with the new job opportunities that might come about because of this. So maybe instead of having a driver, there might be higher end positions that are more service or concierge oriented that would be incorporated into these sorts of vehicles. So there's a lot of exciting opportunities here. I'd love to hear from people on the webinar, as well as if you want to follow up with me afterwards, my information is on the screen. So with that, thank you very much.
Great. Thank you so much, Steve and Dan. I think both presentations have offered us quite a bit of information, and I have quite a few questions that we have from our audience, and I'll try to get to several of them. We have about 12 minutes remaining and get to some. This question is for both of you. We actually had a couple of questions regarding this. Let's start with you, Dan, and then see if you could answer also. I mean, how does Lyft, or do Lyft drivers work with people who have mobility challenges or mobility limitations? And Steve, the same question to you in terms of autonomous vehicles. How are they accommodating people with mobility limitations?
Yeah, so great question. This is Dan. So a couple things. So one thing that we make clear for our partners, the core platform, the concierge tool that I showed everybody, it's really designed for ambulatory curb-to-curb transportation. Now, certainly, if a passenger has a foldable walker, a foldable wheelchair, needs some assistance putting that into the vehicle, our drivers will help. Our driver's mandate is really around curb to curb. So again, just to make sure people understand, our drivers will not help with door-through-door transportation, taking somebody into a medical appointment or into a pharmacy. Now, that said, I want to note there's no additional cost for more people in the car. So a family member, a caretaker, a staff member can always go with the driver, or excuse me, with the passenger at no additional cost and provide that additional assistance. That said, for us as a company, we want to provide all levels of acuity and all levels of transportation. In certain markets today, we do have wheelchair accessible vehicles, and we partner with wheelchair accessible vehicle operators where now you can get access to their fleet using the Lyft platform. And we've also started to partner with home care providers like Comfort Keepers, where now you can get a Lyft if you're a Comfort Keepers client, and your caregiver can be in the car with you, and they can provide that support, that extra door-through-door service. Now, real quick, I just want to mention, too, about autonomous, because autonomous is something that we are also very, very focused on, and something that we're taking a big part in. Imagine you can now request an autonomous vehicle, and in that vehicle you have a licensed and qualified caregiver. So instead of a driver now, you do have another specialist in the car, another service provider, who can attend, sit with the passenger, and be in the back seat with them to provide that additional support. And then also, as I mentioned, we are looking at other vehicle types. We have other partners who specialize in wheelchair accessible vehicles, ambulettes, so on and so forth, that we can work with as well. So hopefully that gives you a little bit of context about what we're doing there.
Great, thank you. Steve?
Yeah, and I'll just add on, I think Dan really addressed the question quite well. That is where we're looking at on the self-driving side, where there are new job opportunities for that caregiver or concierge type service that could be someone in the vehicle. And, I'll also say that, obviously Lyft is doing some amazing work. That other ride service companies are also looking at this in different communities that they may not have necessarily the scope, but there's the Go-Go grandparents and the Silver Rides and others that are looking at different models in this space. And I think it's really exciting to see the different innovations that are coming about to see which business models really work.
Great, thank you, Steve. Yeah, there is a question up here about that grandparents. Second. This question is for you, Dan. Does Lyft have the ability or the interest in partnering with existing nonprofits or the stable transportation system, where the community-based nonprofits would essentially operate or manage services for the clients have?
Yeah, so we work with many nonprofits across the country. A great example is an organization here in the Bay Area called Peninsula Volunteers. So if you actually go to their website, which is just penvol.org, penvol.org, you can see there they have an activity center where they want to bring seniors every day to do physical activity, and they call it Little House. So on the website, you'll see a link to Little House. And if you scroll down, they mention, you need a ride to Little House. We have a partnership with Lyft, and we can help you get to and from the activity center using the Lyft concierge platform. What they do is they just charge a flat $4 rate for the ride. They only charge their community members $4, and then they get grant money and funding to subsidize the rest of the cost. So again, they're only charging a $4 fare. They work with many veterans in the community. We did something during Veterans Day where we provided Lyft rides to veterans to get to and from their community center. So that's just one example, but without question, we know that nonprofits have a tremendous need around transportation. For us, it's really finding, is the funding going to be coming from grant money? There's grants and funds out there specifically for this that we work with our partners to help them get that, and we try to help in terms of doing programs or incentives for new riders who've never tried Lyft before to really make sure they have an effective solution around transportation.
Great, thank you. That was, I appreciate the last sentence on the funding. There was a follow-up question to you, Dan, regarding the charges that you're making and the charges for Lyft with the nonprofits regarding that particular question. So, add anything to that regarding that question? Thank you. A couple of other questions that have come up in terms of, and this would be for both Dan and Steve, is how do you see both of your programs and your presentations today really working effectively in rural America? Steve, do you want to start? And then maybe Dan, you can follow.
Sure, and yes, I completely agree that rural America is one of the major challenges, but also, quite frankly, one of the major opportunities when it comes to some of the innovative transportation solutions. One of the challenges with ride sharing is you do need to have the density of drivers in the area to be able to have that that response time and to be able to have enough cars available for the people looking to have rides. And that's where the opportunity of having self-driving vehicles that can essentially work near full time. Dan had mentioned one of the challenges now is many vehicles actually spend a lot of their time in parking lots and not being utilized. We can cover ground by having a vehicle being able to operate that doesn't necessarily, obviously you have to keep the batteries charged since they're mostly electric vehicles that we're looking at, but they don't need to have drivers that need to take a nap or a rest from driving for safety reasons. But that's something that we're obviously looking at, being able to ensure that these vehicles can operate on a wide variety of different types of roads. I live in a community that's a bit more rural and off a dirt road, so I want to make sure my vehicle works just as well on a dirt road or a snowy road as it does on a road in the middle of a city, downtown, well-painted street.
Right, thank you.
Dan? Yeah, real quick. I mean, I think Steve did an excellent job addressing the question. The only thing I note is, without doubt, we want to be everywhere. We want to serve the largest cities in the country and some of the smallest cities in the country. It certainly takes a little time to get there, but we do believe we will be there everywhere eventually. And we are looking at solutions and tools where we can address specifically those rural markets in a better fashion, stuff that I can tell you we're thinking about and working on every single day. And right now, we know in some of those rural markets our ETAs are not strong, but that said, they are a lot of times better than other alternatives. So whether it's shuttle service or even local taxis, we still are very competitive, if not better, in those rural markets. So we know we have a lot of work ahead of us to get into all these other emerging markets for us, but I can tell you that we are working tirelessly on making that happen.
And I'll just pitch in here one other thing that I do think that is a very important piece there, because in many cases, when you're talking about needing to call 24 hours, 48 hours in advance for a vehicle that gives you a large window to get to a medical appointment, the opportunity to have a ride-sharing vehicle that, even if it's a 15 or 20-minute wait, that is just a world of difference from what people are used to in many cases.
Great, thank you so much. And here's the question. This is a question for Liv, Dan, that came to you, and it's about the GoGo grandparent. It says, how can older person schedule a ride if they don't have a smartphone?
Yeah, so in the tool I mentioned, that's really a solution that our partners like a hospital or an elder care community would use. But to that question, how does a traditional consumer get access to Lyft if they don't have a smartphone? So we actually have a partnership with GoGo Grandparent, and they have a solution that exactly addresses that. So when you call their phone number, they've integrated with Lyft. So they're fully integrated with Lyft in our solution, where now someone can just call their 800 number and request the Lyft, and that gets done through us. We're still servicing that ride. They're just providing a much easier solution for a consumer that doesn't have a smartphone or is not as familiar in using a smartphone. So, we work hand in hand with companies like GoGo Grandparent. There's others. And then we're also looking at ways on our side to continue to make that experience easy and making Lyft accessible to everybody, regardless if they have a smartphone or not.
Great. Well, thank you so much. I think that's our time for questions, but I'd just like to emphasize what you said in terms of, for our listeners, it really is the strength in partnerships, especially in rural America. When we opened, the session, we're talking about the need for partnerships, volunteers, nonprofit organizations, or people really working together. In about maybe 15, 30 seconds each, Dan, Steve, do you have any last final comments you'd like to make?
This is Dan. Real quick, from my standpoint, I just hope if people on the webinar today were to leave with one thing, that one thing for me would be Lyft is a people-first organization. Yes, technology is in the background, but it's really about the people. It's about the drivers. It's about the passengers. It's about increasing the independence of our elders. And the technology is the means of doing that, but it's not technology first. So, from my standpoint, I hope people see and learn a little bit about Lyft, our approach to ride sharing, and our mission around improving people's lives with the world's best transportation. So, please feel free to follow up with me afterwards, but thank you so much for everyone's time.
Thank you so much. Steve, any parting words?
Yeah, I'll build on that. I completely agree. Technology is the tool. Technology does not replace the people in the system. It's just something that can help us help as many people as possible. And the other thing I would say to the people on the webinar is come up with the crazy ideas. Come up with innovations. It's interesting to see, as much as everyone talks about the Silicon Valley startups made from people who dropped out of college, actually there's more companies being started by people 50 plus right now. So there's opportunities for innovation, and I can't wait to see what people come up with and see them at CS next year.
Right. Oh my gosh, Dan, Steve, thank you so much for the webinar, the information today, and the great questions that we had. I'd also like to thank the John A. Hartford Foundation and the Consumer Technology Association Foundation for your support of the program. And thank you all for participating today. We know that aging in rural America has its own unique challenges, but we are heartened by the resilience, the innovation, and the commitment to improving the quality of life of rural older adults shown by so many across the country. We will be making this presentation available to anyone who wishes to view it later, including the slides and the audio. So please watch for a rebroadcast link on our website in a couple of weeks at Grantmakers in Aging at info@giaging.org. And again, thank you all for joining us today. And Dan, Steve, thank you for your time, and you all have a great rest of your day. Thank you.
Thank you.
Thank you.